Thank you very much for the question. Patients with 6 months to live have 6 months to live. They still have their life, and many patients are still of good performance status in those 6 months. If we look upon treating thrombosis as number one as a symptom control measure, we're actually treating the breathlessness of a pulmonary embolus, we're treating the pain in the leg of the deep vein thrombosis. So we're actually using it as a symptom control measure. The secondary benefit is that you are preventing a premature death. Palliative care, and in the definition, palliative care seeks neither to prolong nor hasten death. But when you talk to the patients, they would opt to be treated because the symptoms they're having from the deep vein thrombosis or pulmonary embolus is distressing. I think if we are looking at people who are what we would call actively dying, so they are taken to their bed, they are not taking oral medicines, they are in and out of consciousness, I think in that situation it is less appropriate. But if we have felt a patient is worth investigating for a DVT or PE, so we put them through the investigation, we should only be doing that if we are considering treating them. So I think a 6-month life expectancy for many patients is still a lot of time and they have things to do. The evidence that informs these studies were not done in patients with a prognosis of less than 3 months, but certainly 6 to 3, many patients were there in the studies. And from our experience, we've looked at several hundred palliative care patients in hospices who will have lived for several months on the treatment and have been glad they had it.